Here's the number one reason why working with the eyes can help you so much with chronic pain and help take you out of a sympathetic dominant fight or flight response into a more parasympathetic, relaxed, healing, recovery, regeneration response. And that is the eyes grow directly off of the brain. So the eye is an extension of the brain. What does that mean? It's highly powerful in relationship to brain function. And we know that pain is in the brain, not the tissues. So pain is an output signal from the brain, not an input signal from the body. So if you can change the brain, what can you change? Pain, right? So if the eyes are a direct outgrowth of that, if we work with the eyes, we can make a shift in the brain. And that's what we're going to talk about today, showing you some easy eye motions that you can do. And I'm also going to explain how the eye itself moves because the eye has muscles. The eyeball has muscles that move it. You have six muscles on the left, six muscles on the right, and they work in pairs in conjunction with each other. So you can track things and look at things. And along the way, I'm going to explain the neurology behind the eyes in relationship to the brainstem and how it can relate to head and neck pain and with the sympathetic nervous system. These are just a small piece of the things that we teach you in our Eye Mojo 8-hour intensive course that we're going to actually be having this month. So sit back, enjoy. I think it's going to help you a lot. Let's take a look at the muscles of the eye. You have six muscles in each eyeball that moves it. We'll go over them in detail together. You've got the superior oblique, and I want you to see here at the top that it goes in an oblique angle. So that's really powerful in helping the eye twist. It's called intorsion, extorsion. It's like kind of twisting on an axis. And then you also have the inferior oblique down below. And the other ones are the superior rectus, the inferior rectus, the lateral rectus, and the medial rectus. That will allow you to look pretty much in every direction. All right. And we'll go over those in a moment. Now, these nerves, these muscles are innervated by nerves, and they're innervated by what's called cranial nerves. So, cranial nerves are nerves that come off the brain stem in the back and the forebrain up top here. So, let me break this down a little bit. You can see here you've got this is if you're looking at your back of your skull from the back. Down below here, let's look at the very bottom, you're going to have your spinal cord coming down. You have this section known as, look at my mouse here, the medulla. And you've got cranial nerves 9, 10, 11, and 12. So there's a group of four there. Okay. Then you have your pons that sits above that, and you're going to have another four nerves there. You're going to have the trigeminal number 5, number 6, number 7, and number 8. And you can see here that cranial nerve number 6, the abducens, that's going to actually supply what's called your lateral rectus muscle. And we'll show you that in a second. So that's the LR6 down below. I'm going to teach you a little mnemonic for remembering the nerves that supply these muscles. So lateral rectus is innervated by cranial nerve number 6, the abducens nerve, which basically kind of means to abduct, move away. Then we have the midbrain. Now, the midbrain, you've got the oculomotor nerve, cranial nerve number 3, and the trochlear nerve number 4. So the trochlear nerve innervates the superior oblique muscle, the superior oblique muscle. So that's why it says SO4. All of the other remaining eye muscles are innervated by the oculomotor nerve. So when they teach you, they said LR6SO4, that means the lateral rectus, which you'll see right here. The lateral rectus is number 6. The superior oblique up there, okay, superior oblique, that's SO4. That is what? Trochlear nerve. And then all of these other ones here are by the oculomotor nerve. That's how you can remember that, right? Now, these are important to know because when we start to look at how you can move your eyes and track in different directions, if you have an issue with moving the eye in a particular direction, there may be an issue then with that cranial nerve in the brainstem. You might see this a lot in people who've had head trauma or concussions or got brain inflammation and neuroinflammation. Now, if you look up at this one, this is called the forebrain, and you've got 2 cranial nerves there. That's the olfactory nerve, that's smell, and then you have the optic nerve, which is cranial nerve number 2. So they're technically not on the brain stem. This is the brain stem, midbrain, pons, medulla. But the optic nerve, remember, that's a direct outgrowth from the brain itself. All right? So that's how we know. And this is just another view to be able to look at that region in relationship to the anatomy. All right. Now let's go over these eye muscles and the motions and where they're located. Okay, and we'll go through these one at a time. Now, what I want you to notice first of all here is look on the outside here. You see this line going up on the left-hand side of your screen? That's one side of the letter capital H. And this is the other side of the capital H. And then in the middle is the horizontal connection line. Now, when you assess the eyes, that's what you do. You actually draw a capital H. And then we're looking to see how well the eyes can track along that letter. Okay, because then when we have the eyes in a particular position, we know that we're stressing certain muscles of the eye that move it individually, and we can see if there is a particular problem. Okay, so I'm going to start off in the middle first because it's much easier for you to understand that when we do this. So look at the center here that says primary. That's if you're looking and you're gazing straight ahead, right? So you should see the eyes gazing straight ahead. Now, first of all, if you don't see that, maybe you see one of the iris and pupil of the eyes actually turn and you see more white on one side. That could mean there's an issue with the muscles that balance it, all right? But that's kind of for more in the class, but I want you to just look at what muscles are going to be involved here, all right? So if I'm looking to the right, so if you look with your eyes to your right without turning your head, you're going to be using a couple of different muscles. So look at here. You've got on the right eye, you're using your lateral rectus on your right eye, and you're using the medial rectus on your left eye if the person is following the H. All right. So let me take this and make it bigger, and we can do this together. I'm going to take my glasses off. So if you just kind of follow along with me, and then after you see me do it, you can try it. If a person's looking at my finger and I'm going to move my finger towards their right side, they would follow the finger with their eyes, right? This way. So if I'm looking to the right, if you just turn your eyes to the right, that's going to be the right lateral rectus, which is pretty much where my finger is here, which is going to turn the eye on the right away. And then on the left eye, on the inside, that's the left medial rectus because it's turning in to look inwards. So the left eye goes medial, the right eye goes lateral, and you go like that. So when I bring my finger like this to the person's right-hand side that they follow, I'm looking to see, can they do that? You want to make sure that they use the eyes and not the head. One of the first things I look for of an eye muscle imbalance, eye dysfunction, is that the person moves their head along with their eyes when they're turning. Okay. And they don't even know that they're doing it. So that's a check to, oh, wait, I need to look at something here because they don't have the ability to move their eyes alone to their right. Now, let's say I want to go to the left now. So they would follow my finger towards their left hand side. And then that's going to use on the left eye, the left lateral rectus, correct? And the right medial rectus this way. And remember the innervations on those. The lateral rectus is LR6, right? Abducens. And then this one here on medial rectus is going to be what? The oculomotor, right? The oculomotor. Now, this horizontal one is really critical. This is very important. Whenever you move your eyes right and left, that's a kind of a scanning the environment and horizon for movement and potential threat. Right? So you're hardwired to think about like in the caveman days, you have to scan everything and look and notice is something about ready to jump out of the bushes that eat me up? Am I going to die? So we notice peripheral movement, or we should notice peripheral movement a lot. Okay. They teach you that in the military that I work with. It's called situational awareness. So you just see kind of like the eyes in the back of your head kind of stuff. All right. When you move your eyes, right, what happens is that your brain anticipates that you're going to turn your head towards something that you're looking at or away from something that you're looking at. Right. So eye movement automatically fires the muscles in the back of the head here, which I'll show you a picture of when we get back to the slides, called your suboccipital muscles. The muscles underneath your skull that stabilize your skull are intimately connected to the eyes. So what does that mean? If your eyes have an issue where these muscles are imbalanced, you can overfire, underfire, over fatigue, underuse the muscles in the back of the head. Then you get cervical spine, upper neck, mobility issues where things get stuck, tightness or tension. You can have some stability issues, which means you don't have good control. And that can lead to what? Headaches, chronic neck pain. You get all these massages on your neck. You get manipulations and adjustments that just don't seem to stick or hold. Well, of course they won't, because as soon as you go out in the world and you actually look down at your phone and you start scanning your phone, you're going to use those eyes again that have imbalanced muscles, and the back of your head's going to act up all over again. And you're like, I just don't get it. I can't figure this out. So it could be coming from the eyes. All right. And when you move your eyes left and right like that, that activates certain parts of your brain that can actually help calm your nervous system. That's one of the reasons why this therapy called EMDR can be so helpful for people, because you're using eye movements to calm down the nervous system. Okay. So that's one of the first things that we look at, and we compare one side to the other side. Are you with me so far? All right. Um, so also, let's think about this. Let's expand on that a little bit more. So let's say I'm looking to the right. If I say, oh, I see something on my right, I want to probably turn and get a closer look at that. So what happens is I turn my head and I'm going to engage this muscle here called the sternocleidomastoid muscle that turns the head. And I'm going to engage my trapezius muscles because they also turn the head. And your sternocleidomastoid muscle and your trapezius muscle are innervated by a cranial nerve off the brainstem, right? So which nerve is that? Well, let's go back and revisit it. That's going to be cranial nerve number 11, okay? The accessory nerve or spinal accessory nerve. Cranial nerve number 11 innervates as a motor nerve, which means it's a movement nerve for your trapezius muscle. and your sternocleidomastoid muscle. So what does that mean for you? Well, how many people have tight upper traps and tight necks, and the sternocleidomastoid muscle is a hot mess? If you're in massage therapy or the healthcare field, you know you always find them. Well, maybe that's because your eyes are a hot mess. It could be, and it may not be, but you have to check it. So you do the H examination. All right. Now let's go in towards um, this upper right hand side. All right. So if you look up to your right, up to your right, you're going to be using the superior rectus on the outside eye and the inferior oblique on the inside left eye. Okay. Superior rectus on the right, inferior oblique on the left. So what does that look like? If I bring over to the person's right, and then I take it up and they follow my finger, so now they're looking up this way. Put your finger right here above your right eye. That's going to be the superior rectus on the right. And then I want you to go to your left eye, and I want you to put it right down here in the bottom inside corner. That's the inferior oblique on the left eye. All right. So with the superior rectus, that's cranial nerve number 3. The inferior oblique on this side, that's also cranial nerve number 3, the oculomotor. And many people will struggle with this. Okay. Then I'm going to come down now with the other part of the H, and I'm going to look down into the right. But remember, I don't want the head to move. It's just the eyes. So now when I look down to the right, what muscles are we going to get there? Let's go back. I'm going to get inferior rectus on the right, and I'm going to get superior oblique on the left. Okay, so let's go back to here. I'm looking down to the right. Now put your finger just underneath the right eye right there. That's going to be using the inferior rectus on the right. And go to your left eye, put it right there in that inside corner. That's going to be the superior oblique on the left. So what cranial nerves are those? On the right, it's the cranial nerve number 3, the inferior rectus oculomotor. And remember, the superior oblique is its own individual nerve. That trochlear nerve, that's SO4. Okay, LR6 SO4 here. Now, the superior oblique and the inferior oblique are really powerful muscles because they attach to the actual inside orbit of the eye. Okay, here and here. The other ones don't. They tether back in towards where the eye is originating from. These two go right here. So whenever you have hits to the head or punches to the head or trauma, you always get a big impact on those two nerves right there. So they're really powerful in relationship to eye control after head trauma. Big time, especially if you got punched in the nose. All right. So now we have to go to the other side and check when they go to the left. So now we're going to move the fingers up to the left-hand corner and down to the left-hand corner for the other side of that H. It's just going to be very similar to the other side. It's just switching. So now when we look up to the left, it's the superior rectus on the left and the inferior oblique on the right. So let's go over this one. If I'm going to the left, and now I'll go up to the left-hand corner, that's superior rectus on the left, inferior oblique on the right. So now, on the left-hand side, put your finger right there. That's where the superior rectus is. When the right eye, the inferior oblique is in the bottom inside corner right there. That's the inferior oblique. That gives you this. That makes sense. Now we go down to the left. What does that give you? Down to the left is going to be left eye, inferior rectus, right eye, superior oblique. Okay. So I'm up here. I'm going to follow that H down. So put your finger right here. This is the inferior rectus on the left and superior oblique on the right. So you go inside corner right here on the orbit of the eye. That's going to be the superior oblique down here. All right. Now, what you may notice is that the lateral rectus looks lateral. The medial rectus looks medial. The superior rectus is going to look up. The inferior rectus will look down. But what confuses everybody are the oblique ones, because the obliques do the exact opposite of what their name says. So the superior oblique doesn't have your eye look superior. It has your eye look inferior. Okay? Inferior. That makes sense. It goes down and in. Then the inferior oblique doesn't have your eye look inferior. It has your eye look in and diagonal, like that. Right? So just remember opposites. Superior oblique drives it down, inferior oblique drives it up when you're looking at this H. That's what gets people really, really confused. Now, the H is what I normally do to begin to teach people these things. I'm going to show you these other two in the middle just so you can see. If you look straight up, right? If I'm looking straight ahead and then I just look straight up, look at that's going to be your superior rectus and your inferior oblique on that right eye, and the inferior oblique and the superior rectus on this left eye. Okay. Then if you look down, it's going to be the opposite. All right. Now, the eyes coming in towards each other, like they're both going medial at the bottom, that's the medial rectus. How can you check that? Well, I have a video on this one already talking about the eyes where we look at what's called a pencil push-up, where if I put like a pencil out in front of me about arm's length and I start to bring the pencil in towards, my nose or my forehead, tip of the nose here or here, then what happens is I'm going to follow it in and my eyes should go in medial like this, and they should stay that way. If one pops out, then I know there's an issue with the medial rectus on the side that it pops out from. So if I'm coming in like this and then the eyes are supposed to go in, but all of a sudden my right eye goes like this, boom, it shoots out, there's a problem with the medial rectus on the right. That's kind of big to know because that person's going to have an issue somewhere in the head, neck, face, torso, posture, you name it. All right. Really, really important to understand. So what I usually tell people to do is do the H evaluation, see what the eyes do when they're moving, and make sure the eyes move and not the head. That's huge. And you may be completely blown away at how many people can't do it. Now I'm going to circle back to this and I'm going to wrap it up. This is a view of some muscles in the back of your skull. These are your sub-occipital. Sub means below, occiput is back of the skull, and you can see they're going to attach to the skull down into the vertebra here. So they're major stabilizers slash movers up in the first three joints of the body. And you have most of the proprioceptors in your body, which are tiny sensors that give a sense of body position, live right here. The most of them. Why? Because your brain really likes to know where in the heck your head is. That's very, very important. And when you get a lot of excess tightness or tension in here because you got dysfunctional eyes, you'll start to have poor proprioceptive input into this region. And when you have poor proprioceptive input into that region, your brain tightens tissue down. Why? Because it doesn't know where in the hell it is. That's why. All right. The takeaway from this one is don't overlook the power of the eyes. All right. Start to learn the name of the muscles, the innervation of the muscles, the motion of the muscles, and the pairing of the muscles. This is going to drive you bananas when you first try to start to learn it because it's like jumbled soup. It gets overwhelming and you feel like, oh, you know what? I'm never going to remember these things. I can't remember it. It takes over and over and over and repetition and practice and little and often over the long haul. Just look at it for a little bit, put it down, come back to it, practice it again, and then try to go through the movements like I just showed you here until you get it down. And if you want to try a little move that you can do to just try to start to get these fired up, I'll give you an additional one. Because listen, just doing the H is going to be rocket fuel for your brain and your eyes. Just doing the H pattern is good. And I'll review that with you really quick again. And then I'll just give you a circle clock, right? I've talked about this on my tongue video in the past where you move your tongue and you move your eyes in circles. I'll just show you the circles again. So just start with these couple of drills. If you're doing an H to assess on somebody or you just want to move your eyes, here's how you do it. You put your finger out in front of you, all right? But just, I don't know, about arm's distance apart, maybe a little bit in front. Don't overthink it. And all you're going to do is move your eyes, not your head. So I'm going to go to my right. Don't go too fast. I go up to the right. I go down to the right. I come back up. Now I go over. I'm going to move the mic to the left, up to the left, down to the left, back up, and in the center. And if I want, I can take this in the center and just go straight up. And then I can take this in the center and go straight down without doing this with my head. And the other one are just circles. You can use your tip of a pen. You can use your finger, whatever you want. Put it out there in front. And all you're going to do is do like a circle. You can start with small circles in the middle. Do like counterclockwise. Then you can do clockwise. You can make them and expand them, and then you can start to make them bigger. So I'll show you a nice little spiral. I'm starting small in the middle, and then I'm going to slowly make the spiral like a spiral staircase. You don't have to go this fast. I just don't want you to get bored. And then go nice and big and follow circles and just blink. Right. Then go back to it, start in the middle, and then do small circles clockwise and make your spiral. Don't forget to breathe. Keep your mouth closed, teeth together, tip of the tongue, middle of the tongue, back of the tongue, at the roof of the mouth, breathing in and out through your nose. And do it like that. And just try to do those exercises maybe 3 to 5 times a day for 5 to 7 days and see what you feel. You might feel a little dizzy. You might feel a little bit nauseous. That just means you probably did too much. These are way more powerful than you think they are because they're neurological exercises, which means they're brain exercises, right? It's not your traditional get your reps in, hashtag beast mode monster, pain is weakness leaving the body kind of drills. It's very easy to fatigue the brain when you have poor muscle control with the eyes. So it just takes time. All right. Thanks so much for tuning in, everybody. I hope you enjoyed it. Go back and watch this several times. Please share it with others as well if you thought it was interesting. And if you'd like, you can certainly learn more from us at our iMojo course as well. I'll put a link in the bottom if you want to check that out and learn more about the course. So, and leave some comments below of some future videos that you might want to check out. And also, um, if you missed any of my prior videos on my channel on the tongue or the eyes, just keyword search that on my channel. It'll show up, pop in there, and I think you'll find there's some pretty cool stuff in there as well. Oh, and don't forget to hit that subscribe button. Take care, Dr. Perry. We'll see you soon on the next video. Have a great one.